we've assumed that the wonders of public health and modern medicine will continue to increase our life expectancy. And for those of us in this room who are dedicated to good health habits, it will continue to advance. But in terms of the population average, obesity may be the first thing ever that actually starts to plateau and then decrease our life expectancy over the next 25 years. Even smoking, when we got to a societal rate of 43% of adult Americans smoking, did not decrease our continuous improvement and increase in life expectancy. Obesity may be the first thing ever that does that. But that's not even what impacts you and your organization, because it's tragic, but doesn't change your workplace if a worker dies from an obesity-related cardiac event. What happens is all of the morbidity, all of the other health problems that arise decrease that person's ability to do the job that you've hired them to come into your organization and do. To the point now, when, again, medically obese, not overweight, medical obesity physiologically adds 20 years to the chronological age of one of your workers. So, for example, you're examining safety risks in one of your factories. You've got a 58-year-old worker out on one of your loading docks or loading packages in one of your trucks, something like that. Think of that person, if they're medically obese, if they have a body mass index greater than 30, that's actually the body of a 78-year-old person lifting 100-pound boxes on the loading dock. And we wonder why workers' compensation is such an issue and long-term disability rates are such an issue, and eventually other aspects of our group health insurance plan go up because of the increased risks for adverse health events from other lifestyle behaviors, to the point where now between 2/3 and 3/4 of every dollar you spend in your group health plan is in some way a completely preventable expense based mostly on a lifetime of behavioral modifications that could have prevented that expenditure in your organization. So how much does this cost us as a society? And then we'll try to break it down a little bit more for you. It's already getting close to $250 billion per year in the US alone, such that it's over 10% of our costs and quickly going to go up to 20% of all expenditures on healthcare insurance through group plans and public plans in this country. Some good research suggests that between 1/4 and 1/3 of the entire reason for health insurance inflation being higher than the regular CPI is entirely attributable to that steady march upward of the average prevalence of obesity in our country. That accounts for a very large proportion of the reason why health cost inflation outstrips the CPI. Since energy was a main theme of this conference, if we looked at it in those terms, we've consumed an extra 350 million gallons of jet fuel in the last 10 years, only because the average adult American passenger is now about 10.3 pounds heavier than they were 10 years ago. 350 million gallons of jet fuel just for that extra 10.3 pounds. And doesn't have anything to do with the extra baggage fees and the other weird things that have happened in the industry lately. If we were simply to revert to our average obesity prevalence from 1998, that alone, if nothing else changed, that alone would add back $250 billion to our GDP each year. But yet, throughout the health reform debate, you did not hear politicians on either side of the aisle stand up and say every single person listening has to have some dog in this fight, not just the way we argue how we're going to manage costs through insurance programs, but that every single American, perhaps the most patriotic thing you can do is to go take a walk this afternoon and try to increase your own health a little bit, which is going to decrease the cost burden on our grandchildren. But it's extremely difficult to motivate public action in that kind of a forum. So we're left with trying to shuffle proposals and plans behind the scenes rather than getting people to be involved in their own health to decrease their need for health care down the line that we would end up having to pay for. If we compare the increased costs in group health plans between smoking over the past half a century or so and then obesity, it's an interesting It's an interesting comparison, mostly because smoking takes many, many years to cause its effects. But obesity starts to have physiological effects on your body almost right away. Let me try to explain what I mean. So this is a statistical increase in healthcare costs of a person with one of these two conditions, either they're a smoker or they're obese, over someone similarly situated who is not either a smoker or obese. And this is originally from European data. These numbers are actually dramatically higher now in terms of the increased cost versus the non-obese. The area under the curve is about the same throughout the lifetime of somebody who either smokes or is obese. But because of our two-headed system in America, this is a dramatically different answer for you in an organization. So for example, traditionally, smoking is the lighter colored line. It caused some increased costs for sure in your organizational group health plans, but a lot of the real cost was dumped on the public programs down the road, Medicare and Medicaid, once people retired from your organization. Obesity starts to increase your costs on day one when they enter the workplace, if they're already obese. And now because our adolescents are so much more dramatically more likely to be obese than even 10 and 15 years ago, these costs are only going to accelerate within your organizations. So you, at the organizational level, even if you've successfully decreased your smoking percentage, you're paying this entire extra nut in the middle between those two if you had the same percentage people. So that partially explains one of the increases in your workplace. But again, it's easy to understand the increases in your group health plans. It's all of the other harder to measure, harder to pin down with a specific number that really is more costly. In some cases, 2 to 3 times more costly than your health insurance premiums attributable to obesity. So for example, obese individuals versus non-obese individuals dramatically increases the number of sick days and other measures of absenteeism, presenteeism, these other factors that we're trying to measure health productivity of the workers in your organizations these days. Decreased morale between different groups within. Changes in the way your brokers are able to quote and do the actuarial studies on group life and disability premiums once they look at the demographics in your organization as they change through time. And some major workers' compensation implications that we'll get into some specifics in just a minute. If we look at the cost of diabetes, which in many cases, type 2, or what we used to call adult onset diabetes, is one of the end results for many people who are obese, that also is a dramatic cost within the structure of your organization. We're looking at a similar annual national bill for diabetics this year, to the point where even though it's only about 16 to 20 million adults carry that diagnosis, 1 out of every 5 healthcare dollars spent in America is spent on a diabetic individual. Not necessarily because of the diabetes, but they have so many more comorbidities and other health issues that 1 out of $5 are being spent on diabetic individuals. But the problem is that number is going up dramatically every year. We're adding 1 more million adults to the ranks with a diagnosis of diabetes every year. And we're now projecting that 1/3 of American adults will develop diabetes during their lifetime. That adds, on average, a diabetic versus a non-diabetic, all other things being equal, well over $6,000 per year within your group health plan. And we're adding $1 million a year to the rolls. And now we're doing much better work in terms of screening those at risk for pre-diabetes so we can identify them earlier, get them into the system, and then these numbers will even increase as we go down the line, with huge productivity losses in your organization. If we look just again at obesity and its effect on the ability of people to come to work when you expect them to come to work, there's a statistically significant linear increase in the number of missed work days based purely on the categorization of the employee's weight class. So if you look at normal or overweight individuals in the first 2 categories, there's a dramatic, definite linear increase in the average number of missed days of work for health-related reasons throughout a single work year, to the point that what we consider grade 3 obese, or this is what's termed morbidly obese in the media, miss on average 1 extra work week per year over your normal or overweight